Hi everyone, this is Bibhusan Basnet. I'm one of the associate editors at AJPHI. Today I'll be helping you guide how to write an article for AJPHI. I'll be focused only on the review articles for today, just based on the limitations I have. Okay, how to write a review article. First, title. It's very important. You got to make sure the title is concise. The title should have the best SEO. SEO means search engine optimization. Do not write like heart failure, clinical diagnosis, pathogenesis, diagnosis and management. If you want to write heart failure, write heart failure, how heart failure and the science behind keeping you at home, heart failure and the science, heart failure and how medication therapy can fix your heart, something that should be catchy. You know. Abstract. This is a very common mistake I've seen. People write an abstract in a structured format, but at AJPHI, we write the abstract in 5 bullet points, and we try to explain 5 specific things that are important for patients and families. So 5 bullet points for abstract, simple, no structure, and limit to 5 keywords. In the article itself, we have rephrased the article writing style for AJPHI. So number 1 is introduction, and number 2 is discussion, and this is freestyle. Number 3 is conclusion, and then number 4 is conflict of interest, and number 5 is questions for your doctor. So these are the major styles you got to adhere. But the discussion section is very freestyle. So, for example, you're writing about SLE, like lupus. You want to say why lupus, why you want to talk about lupus, why lupus is so important, and maybe a few lines on data about lupus and how common it is, but not much about data. Patient and family like numbers, but only numbers that are easy. You don't want to keep on loading them with numbers. Don't trouble them with numbers. And then go to the discussion part. In this part, after the introduction, previously we used to write clinical feature, risk factors, and diagnosis. We don't want people to like stick to that guidelines. We want to, for example, if I'm writing about lupus, I could write about the clinical features, but make it into a few, like 3 paragraphs, like 3 simple paragraphs. Maybe one paragraph I can write about skin changes in lupus, one paragraph about systemic manifestations in lupus, and one thing, if I want to write about lupus in females, like something that interests people. While you're writing an article, you want to make sure that it's of interest to people, not what's in your head, right? So, for example, if you want to write about lupus, we want to encourage authors to write about myths about lupus and why they are just myths. Explain those things. Like, for example, risk factors. You might know like lots of risk factors for disease, or you might not know all the risk factors for disease. If you know something interesting like in heart failure, one of the major risk factors is ischemia, like loss of blood supply to the heart. Then explain a paragraph in this loss of blood supply to the heart, and maybe, but you don't need to explain like there could be like 8-10 risk factors that you have studied or you need to explain everything. You want to explain things that are important. You want to explain things that you want to convey to people. Well, when doctors write about causes and risk factors, we went to med school and we are trained to write like around 8 to 10 causes factors because we know every of them. But we want to make sure in this article you focus on things that matters the most, like in diagnosis, like heart failure, right? You want to, maybe you want to write on a paragraph why BNP matters and why it does not, is it's not that helpful. But I would focus on echocardiogram in case of heart failure than any other things. You want to explain what an echocardiogram is. You want to explain how it helps determine the severity of heart failure. And then you can explain why other tests too. If you think you want to explain an MRI of the heart, that's fine too. You can explain why MRI of the heart could be important in heart failure. Yes. You want to explain why a cath is important in heart failure, when you need a cath in heart failure. You can explain that, but under a different paragraph, not just write a single line. On the management part, so what you want to do is want to focus on things that matters the most here too. Like I'll show you some examples how you wanna write, but I just don't want you to write for the sake of writing. I want to make sure that patients understand what's in your mind. So if we want to write an article on kidney failure, I want to make sure you have some introduction and you have like at least a couple of pages, like around like 10 paragraphs on about kidney failure. It could include about diet on kidney failure. It could include about new medication that can slow the progression of kidney failure, and it could imply write about why kidney failure gets undiagnosed. You can write about why it's kidney failure is so important. The burden of disease in the community. You can write about dialysis and kidney failure. You can write about diet and kidney failure. You can write about salt and kidney failure. Something that people want to hear about, not about the causes and risk factors of kidney failure, right? No, you understood what I mean. You want to focus on things that people are looking for. Like, for example, if I'm writing about chronic kidney failure, I'll Google or even use Chat GPT and say, like, tell me 10 topics that people are searching about kidney failure. And then, you grab the topics and make sure you put the topics in the discussions. So, and then we have a section for you can write a section for tips for patients and families. Some tips. This could be some in pointers, or it could be in paragraphs. It depends upon your style. But the tips, I really recommend people to be like hashtag 5 tips for heart failure. Hashtag five tips for people living with kidney disease, something like that. Conflict of interest, never forget it. And questions for your doctor. 5 to 7 questions that you would like to ask your doctor. Simple questions, okay? And the reference at the end. Here are the formatting guidelines. Keep your words around like 4,000 words to the max. Number of authors limit to 4. Um, we have strict plagiarism policies. We like people using the AI-based softwares, like language learning models, but make sure you use it to frame your work, not to write it down. We will go through a peer review process, and there will be a double-blinded peer review to make sure that the quality of the article is good. Make sure, and then you can always use how to reference articles, right? Like, for example, you could use reference articles by the American Heart Association guidelines, ADA guidelines, where appropriate. Do not use medical jargons at all. Do not use, you know. Um, if you have some ideas on infographics, you can write it down in infographics so that our graphical team can work with you closely and get the right infographics. This is an example of an article um, for someone living with diabetes, right? And you want to focus about continuous glucose monitoring. You want to write about when to start insulin. You want to write about role of dietitians in diabetes. You want to write about dangers of stopping insulin abruptly. Like, make a paragraph on that. Okay. So when you are writing about glucose monitoring diabetes, do not write about the diagnostic criteria for diabetes like A1C, da da da. People, if you want to write about those criteria, if you think they're important, explain in simple words. I don't want you to write the symptoms of diabetes. You can write what diabetes can present with, da da da, but signs and symptoms of diabetes, signs and symptoms of heart failure, people know it. That's why they're looking to articles. So try to allure them to article, not just explain. Pathophysiology, I don't want to, if I see pathophysiology of some disease, I just skip that thing. Um, so make sure you write the article in a language that a sixth grader can understand. So basically, title, abstract, introduction, Why glucose monitoring matters at home, advancement glucose monitoring, special circumstances to address, like children with diabetes, elderly with memory issues, during sickness, what to do, during fasting, how to stay safe, some discussions, common mistakes and how to avoid them. Uh, you know, so these are the discussions. I would say discussion means from why glucose monitoring matters at home till the final part here. So, and then a small paragraph for a conclusion, confident trust and referencing. So these are the major things. Let me take you to other page where um, you will see how an article was written. This is one of this article was written by one of my amazing author, and I just wanted to use this as a reference where we could make improvement, where the common article writing style and the article writing style for AJPHI is different. So title, look at this title. It looks like a title written by a doctor, right? It says hormone changes and the systemic impact during menopause. What we can do to help? I'll simply say hormonal changes and how it hormone changes during menopause, how does it impact your life or something like that. Easy, you don't need to write the systemic thing and stuff like that. Easy art thing. You can even put this in chat gpt and ask, like, give me, for example, 5 topics similar like this which are easy for readers to understand, best SEO, and uh, are captivating, something like that. And you can choose the options. Abstract, okay. This abstract should be written in 5 pointers. So so menopause marks permanent cessation of menstruation fertility, usually occurring between 45 to 55 years of age. You got to make this simple. This is like a doctor writing. Okay. Even these things, it's a biological transition driven by hormonal change, especially the decline of estrogen and progesterone. I would say during menopause, both the estrogen and progesterone hormones start decreasing, and that can bring to various changes, something like that. You don't need to write these things. You don't need to write all of these things. You want to write things that people want to hear about. 5 things that drives people to go to article. Okay. Introduction. This is good. Uh, enough enough data, but we want to write in very simple words. Very simple words. Like, for example, you can take this in Chat GPT, copy paste, and say, like, right, rephrase this in a way that a sixth grader can understand, and then see the difference. Okay, and then rewrite the paragraph in your style. So after introduction, so you want to write about a hormonal landscape of menopause. I like the topic, I like the heading, but I would say I would rephrase this in a very simple manner. This is very straightforward. I want people to understand this. So I want to make sure that we write this like for patients, not for colleagues. This is like a doctor writing for doctors. So we got to change this. Okay. Uh, and endocrine disruption and systemic consequences. Oh, that was tough. So what we're going to do is we're going to write about uh, what endocrine problems you can have during menopause or something like that. Okay, so you got to write it down. Endocrine disruption during menopause, and so clinical manifestation of menopausal hormone change. You want to say, like, how does menopause look like? That's much easier. So you don't want to write vasomotor symptoms, gynecological symptoms, sleep disturbance. This is this for doctors. So you want to explain this in simple paragraphs. You want to make it in 2 paragraphs? I'm good with that. Body systems affected by menopause. I would not go by like this style. I would just, if I wrote this up, the first thing, this one, vasomotor symptom to sleep disturbance as a single paragraph, I would write cardiovascular system and menopause. Your heart and the menopause. How menopause affects your heart. That would be my title rather than cardiovascular system. And then I'll write a few liners on mental effect and menopause. If you want to write about it, genital system, skeletal system, it's okay to write a few lines, but I'm okay to avoid this. I wanna focus on things that matters to people. So skin changes during menopause. It's a very good thing. No, in menopause, it's people wanna hear about skin changes in menopause, and I think it's very important to women. So I think write a bigger paragraph on skin changes and long-term health implications. I would say focus on cognitive decline because that matters to me the most, more than our like metabolic syndrome and menopause. Write a paragraph on that rather than writing sarcopenia. And it's a good topic as doctors. You don't want to miss this because these are important things. But while writing this kind of article for patients and families, you want to focus what they want, not what you want. So treatment. So look at this HRT, right? So it was very straightforward. It's like, and then someone has written like the WHI study. Ooh, you don't write like this here. So treatments, I would say like hormonal treatment for during menopause, right? And then I would say you could focus on this, like a few paragraphs, why hormone treatment works, and then non-hormonal treatment for menopause, why these things would help. I would say write it down in simple languages rather than points. If you want to put some points, like if you write a paragraph on hormone treatment, you can write pointers on non-hormonal therapies. I'm fine with that, right? But uh, and this the way that he or she has written the referencing is amazing because I want to make sure everything comes to reference. You cannot just blah blah blah. Even osteoporosis, uh this should have a reference, right? This should have a reference like biphosphonate and denosumab I recommend it for women at higher fracture risk. It's very straightforward. During menopause, you're a higher risk of osteoporosis because of this, and this. So these medications are recommended for women at higher fracture risk. If you want to write a small paragraph on that. And then community-based interventions, these things. I would focus in this into one thing. If you want to focus on one thing, like a telehealth support, or if you have some data, how it has helped, something interesting. Otherwise, I will not even write any of these because people will skip this. You don't want people to jump to other article. And the questions to ask a doctor and points and conclusion. So I would say conclusion comes first, and the question to ask a doctor comes back, and then referencing it's a decent. I think it was in a Word doc, it was in a PDF document. I just copied to a Word, so it's like this, but referencing has done pretty good. So overall, I would say my take home message is title should be good, simple language but catchy, abstract in 5 pointers, introduction to start with, and then you want to focus on things like menopause, right? I want to focus on hormone changes and menopause. I want to focus on osteoporosis and menopause. I want to focus on skin changes. You can talk about um, hormone changes and menopause and skin and what you got to do. Like you can talk about what people go for Botox therapy, or people go for like um, take medications to help with those flushes, or anything. Just focus on things that you want to explain. You could have a different perspective to hormone changes. That's what we want to bring to this article, not what everyone thinks. We want to get your perspective to this article. And then you can write about treatment. Um, um, you can write about in the treatment too. You can focus on things that you want to focus on. Like I would focus on raloxifene. I would focus on um, the osteoporosis treatment, and I would focus on the cardiovascular and the problems during menopause, rather than any other things. So now I would say overall, every writing is different and every writer is different. But I want to make sure we write things that matters for people in simple words. I think this is enough for today, and I will. If you have any questions, feel free to write to me or the editorial team. I would be happy to answer questions. But that's it for today. Thank you.